Assalamu alaikum, ministers, excellencies, distinguished guests, ladies and gentlemen. Welcome to the official launch of the Doha Global South Health Policy Initiative. The Middle East Council on Global Affairs and the Bill and Melinda Gates Foundation, with the support of the Ministry of Foreign Affairs of Qatar, are partnering on launching a South-South platform that brings together senior public health officers from low and middle-income countries to explore solutions for the issues they face on the ground and identify targeted areas for international community support in those countries. Whenever I hear South-South nowadays, I remember 10 years ago, this European journalist who stood very confident of herself reporting on an election happening in a southern country. And she said that she believes there's a silent economic crisis that the government does not want to talk about. And her indication to this economic crisis was that celibate men and women are still living with their parents even when they finished university. In case you don't know, we keep living with our parents until we get married, even if we're millionaires here. So for this, to avoid a waste of time and efforts, there is this initiative happening with leading Qatari institutions. The Doha Global South Health Policy Initiative aims to establish a collaborative dialogue and learning platform for Global South countries, providing them with an opportunity to address the challenges they face and explore implementable solutions to enhance their healthcare systems. Over the next 2 days, the 2024 inception convening of the initiative brings together representatives from 9 Global South countries, along with key international and Qatari stakeholders, to discuss the challenges and solutions for enhanced access to primary healthcare services in the Global South. The discussion will pave way for subsequent activities and events that will convene larger country participation, high-level participation, and resource mobilization efforts. Why in Qatar? No, it's not only because of the diplomatic efforts that Qatar is doing globally to bridge the gap between North and South and in the role it plays in this interconnected reality, but I believe, from my own analysis, personal analysis, as a resident of Qatar and as someone who's been following the health policies, that one of the main reasons is Her Excellency, Dr. Hanan Al-Kuwari, the Minister of Health of Qatar. She just was awarded the Best Minister Award yesterday at the World's Global Government Summit. She is also the Managing Director of Hamad Medical Corporation. I know firsthand that she was behind a lot of health policies in this country on Alzheimer, palliative care, cancer treatment, natal health care, children and women health care, and much more. And this is why she is part of this. She is also the chair of the executive board of the World Health Organization, and she will tell you more why it's in Qatar. Please welcome to the stage, Your Excellency.
Your Excellencies, distinguished guests and delegates, Assalamu alaikum wa rahmatullahi wa barakatuh. I'm really pleased to be here with you to witness the start of this important initiative to support the achievement of universal health coverage in low and middle income countries. Thank you to the organizers of this event, the Middle East Council on Global Health Affairs and the Bill and Melinda Gates Foundation and the Ministry of Foreign Affairs in Qatar for bringing us here together. This is a critical issue worldwide for global health, as emphasized by the centrality it has in the United Nations and the World Health Organization policies. Let me stress here the importance of orienting our actions to support the achievement of the Sustainable Development Goals and to implement the new World Health Organization General Program of Work that will be adopted at the next World Health Assembly. Primary health care is essential health care based on practical, scientifically sound, and socially acceptable methods and technologies. It should be universally accessible to all individuals and families in the community through their full participation and at a cost that the community and the country can afford. We know that despite major improvements over the last decades, access to primary health care, even the most basic health services, is a challenge in a number of countries. Geographical remoteness, inadequate infrastructure, and a scarcity in trained health workers all contribute to this complex reality. In some areas, the situation has been deteriorating due to the conflicts, environmental degradation, lack of resources, and poor management and direction. Primary health care is indeed the cornerstone of health systems, providing comprehensive and holistic care that addresses not only the curative aspects, but also preventative measures and health promotion. It is on this basis that we have developed and enhanced primary health care services and infrastructure in Qatar over the last decades. In doing so and focusing on prevention and early intervention, we aim at reducing the burden of disease, improving health outcomes, and enhancing the overall quality of life. Qatar's comprehensive, globally recognized network of primary health care services are a strong example of well-structured health systems, and our Primary Healthcare Corporation stands ready to, through the State of Qatar's program to support low and middle-income countries, to partner with their colleagues for exchange of expertise and training. We also know that primary healthcare fosters community engagement, empowering individuals and communities to take charge of their health and well-being. It plays a crucial role in addressing health inequalities and social determinants of health, tackling the root causes of disparity in health outcomes. By addressing health in all policies, we can tackle factors such as poverty, education, sanitation, access to clean water, thus promoting health equity and social justice, and ensuring that everyone has the opportunity to live a healthy life. In conclusion, primary health care is not just a component of health systems, it is the foundation upon which the health and well-being of populations are built. We hope that through this initiative, fully in line with the internationally agreed global health strategies, we can collectively contribute to strengthening primary health care in the global south, investing in its infrastructure, its workforce, and its resources. Together, we can build healthier, more resilient communities and achieve the vision of health for all. Thank you very much.
And now, for the first convening for the Doha Global South Health Policy Initiative, the Middle East Council and the Gates Foundation are organizing this high-level panel discussion on enhancing primary healthcare access in the Global South, the challenges and solutions to set up the tone for this convention and this initiative. Please welcome with me Dr. Chris Ilyas. He is the president of Global Development. Please take your seat while I'm presenting you. He is the President of Global Development at the Bill and Melinda Gates Foundation. He oversees the foundation's portfolio in maternal, newborn, and child health and polio eradication, among others. Dr. Saleh Al-Marri, he is the Assistant Minister for Health Affairs at the Ministry of Public Health in Qatar, overseeing public health strategy implementation. Dr. Rana Hajji, the Director of Program Management at WHO East Mediterranean Regional Office. She is a public health leader with 30 years experience in global health. Dr. Joy Punapi, the Executive Secretary of the African Leaders Malaria Alliance, and she is the former Minister of Health of Botswana, former Assistant Director as well, Director General at WHO. Dr. Deo Nshimirimana chairs the WHO Emergency Preparedness and Response Technical Advisory Group for the African region. Before that, his role at the WHO included Director for Immunization and Infectious Diseases, and he was the representative of WHO in Senegal and DRC. And to moderate this panel, we have with us Dr. Tariq Youssef, a senior fellow and the director of the Middle East Council on Global Affairs. His career has spanned the academic and think tank world as a faculty member at Georgetown University He will be telling you more about this panel and moderating it. Thank you very much.
Bismillah wa salatu wa salam ala Rasulullah. Thank you, Rawa, for a very kind management. And thank you, Dr. Hanan, for honoring our presence today with the launch of the Global South Health Policy Initiative. And thanks to all of you for being with us today on what we think is the beginning of a journey. Just 2 days ago, I had the pleasure of co-writing an opinion piece with my dear friend Chris Elias from the Gates Foundation, where we try to outline the goals, ultimately, from launching this convening. One phrase in particular in that opinion piece I found most reassuring. And it was not my phrase, it is Chris's. When he said, by launching this convening, focusing on the Global South, we're not just convening a meeting or bringing together a group of observers, analysts, and civil servants to discuss problems. Our ultimate goal is to start a movement that will seek to achieve a more equitable and a more inclusive and healthy world. It is precisely with this background in mind that we've gathered our esteemed panelists. I'm not a health policy specialist, but I've learned to appreciate what they do. Having observed over the last decade across many parts of the world, not only stagnation in health outcomes, but outright decline. The disparities we observe today across the world, especially in the Global South, in the health arena, are a cause for concern. They're a cause for collective thinking. And they are a motivation for us to learn from people who've been in this business for far longer than most of us. Against some of these bottlenecks and the barriers we observe, we have in mind an initiative where practitioners from around the Global South bring their experience, bring their expertise, bring actual, identifiable solutions that can be scaled up, that can be actioned, that can be funded. It's this cross-learning platform, this knowledge sharing, that we hope collectively will make this initiative different, will allow it to begin to make a difference, and will become an annual convening, inshallah, in the state of Qatar, in Doha, but with the Global South and the international community behind it in full support. Dr. Saleh, I'm going to start with you, the first question, to help shed light on these broad outlines of the problem I shared and what can be done about it. Qatar is a country in the Global South. It has made immense progress in the last decade. Primary care, but also around primary care and beyond primary care. I suppose one question, and it's a question that many of the participants have asked, what can Qatar's experience offer to the Global South? How can Qatar share in that knowledge in how you build a world-class healthcare system for countries in the Global South? Many of them are represented today.
Thank you, Mr. Tariq. First of all, I'm really privileged to participate among a very esteemed colleagues. Answering the question, I think it's really a very big question to summarize and answering. But I can always start that by saying that in Qatar, we see the critical need to ensure access to health services to be able to achieve the universal health coverage SDG 3.8 target. And we think that access should cover not only the curative services, but also the preventive services as well as the access to health promotion activities, and that is for all individuals and communities. I should say thank you to Her Excellency mentioning that primary health care is the foundation of health services, and this is really where I can quote that this was really from the strategy, National Health Strategy 1, and we have with us also Dr. Mariam, the Managing Director of Primary Healthcare Corporation. Our experience is that access to health services is critical and shouldn't be really during the normal times, but also during special situations. When I mention special situations, are these that are really bring happiness and also on the contrary. So it is something that we need to build on, to mitigate and also prepare so that we can really respond actively, but also we can recover quickly. In Qatar, we managed to secure and ensure access during large mass gathering events. Example of which is as everybody know, is the World Cup 2022. And just recently is the Asian Cup 2023, but we say 2024 because there was a kind of a delay. Or even we consider the access during the exceptional times, like COVID-19 pandemic, during which Qatar ensured access through many dimensions, but I would really specify the telemedicine, the hotlines, even the distribution of medicines at home and beyond. To secure access, there is a need to ensure, and that's for everybody to really think about. And if not starting, already started, then we need altogether to assure that there is a need to ensure that a certain number of health activities and sectors are in place. One is planning, which is really the key to investigate needs, ensure a comprehensive approach, and help us being flexible, but more importantly is adaptable, so that we need to adapt to different evolving contexts. In addition, strong relationship or strong leadership, I would say, is essential. As Her Excellency mentioned, health in all policy, one government approach. So leadership is really essential. And it's not only one person, it's really a group of leaders who can always ensure that our decision makers are well informed to take the best actions. Well-equipped health workforce, we understand they are really the backbone of any health system, is another major element for success. So we need to ensure that our staff are well-trained and informed to be ready for any deployment or for any shift of activities like what happened during the pandemics. Tools and mechanisms are really essential and should be in place to facilitate, again, the decision-making, action, and more importantly, documentation for better access. Those are not alone and can be also adding innovative IT digital tools like software, better communication, pathways, as well as the medical records. Lastly, from our experience in Qatar, I would like to add that if we want to increase access, we need to work with individuals and communities. So we need to build trust, to ensure cooperation of communities. For that, we need to use social media to provide information like what we did and others did during COVID by providing information in multiple languages. We need also to ensure inclusion, specifically target priority groups like elderly, people with special needs, and other vulnerable groups. This work can also be done with strong coordination with key sectors, stakeholders, including academia and research. And we thank Her Excellency for adding to our strategic committee the scientific and research, and it was really very grateful when it comes into forward thinking. Sorry for having been a bit long, but I wanted to share our experience with my colleagues in the spirit of this Doha South Health Policy Initiative, where soft diplomacy and cooperation are cornerstones. I thank you.
Thank you, Dr. Thank you, Dr. Saleh. Staying with achievements, but taking the discussion to the regional and global level, I'll turn to you, Dr. Rana. WHO has been helping countries help health outcomes for over 75 years now. You've been working for over 3 decades in this. Reflecting on this broad experience, what have been the achievements? How much progress have we made globally and regionally over this period of time?
That's great. Thank you very much, Tariq. Assalamu alaikum, sabah al-khair. It's really a pleasure and an honor to be part of this meeting. I'm very happy to be part of the movement you are launching. I think this is great to have such a movement, especially now in the aftermath of maybe the worst pandemic since the pandemic flu, to really see that momentum, building on the momentum of everything we learned after COVID. Since you mentioned 30 years, now you are reflecting my true age. I would like to really reflect on achievements by the global health community, not just WHO, and maybe a couple of words about the role of WHO. So I think to start this meeting on a positive note, because I think there's a lot of positive things that have happened in the world over the last few decades. I think we've gone a really long way in terms of what we achieved in terms of some of the indicators of major issues like child health, women health, and others. Especially with relevance to this initiative, I would like to comment that initiatives, these global initiatives matter. And one of the main initiatives that we are continuing all to follow up on is the SDGs, the Sustainable Development Goals that started with the Millennium Developmental Goals and now moving into the SDGs till 2030. And this is a global initiative. Of course, all initiatives have limitations, but this has resulted in significant reduction in child mortality, significant reduction in maternal mortality, many other achievements that were part of the MDGs, not just for health, for education, for development, for others, that we are now trying to continue and build on for more sustainability with the Sustainable Development Goals. Another major important issue when it comes to policies and initiatives is the universal health coverage, primary health care initiative with the Al-Ma'ata Declaration, then followed by Astana Declaration. Again, this is for the first time where member states, countries are actually committing to primary health care. And we all know without, strong PHC, there's not going to be universal health coverage and equitable access to all the essential services. For WHO in particular, as you know, WHO has always been a normative organization. We focus on the strong, on developing the strong technical scientific evidence base that will guide development of various policies and strategies. But we are increasingly becoming more operational, especially in our region in particular, and many of the countries with emergencies that require a lot of more operational support. I think WHO, in terms of normative guidance, has provided support for many of the new strategies, policies that are guiding and providing support to member states to take these policies and basically adapt them to their country context, regional context, and then implement. I think we will have a lot of time to discuss during this meeting maybe this big jump from policies to implementation, which is where really this is where the proof is going to be in terms of the success of all of these policies. But I think the main thing for WHO in terms of overall initiative is the increasing focus on strengthening health system. So we all know this is the main, I mean, I'm by training, I'm an infectious disease specialist, physician, and epidemiologist, but I keep saying I'm a convert to the importance of strengthening health system. Without that, we're not going to be able to really develop the platforms and the sustainable successes that we would like to see. So the defining the building blocks, supporting them, supporting member states to really move ahead with strengthening their overall systems, I think is going to be our most important task for the next at least few years, so that we can meet the SDGs 30s, and very importantly, also to focus on primary healthcare as the main platform for UHC, and with support already from Gates Foundation and many other partners. You know, for example, we have been part of the disease control priority. We are now DCP3, getting ready for DCP4, which has defined the essential health packages, and now trying to support implementation in few countries with some pilot projects, and hopefully this will be much broader. So I think overall, you know, as a global community, we have done quite a bit, but especially after COVID, which was the real, I think it was the litmus test. COVID really showed us where our weaknesses were. And we need, before we forget, because we keep saying the world always goes in cycles of panic and neglect, before we forget, we need to capitalize on the lessons learned from COVID and start filling these gaps. We don't have to start from scratch. There's a lot of good things. We need to fill the gaps. We need, even for such an important initiative, I think we need to define where are the gaps that we really need to fill as a global community. And as WHO, one of our last thing to mention, one of our always key roles was convening and bringing partners together, which is great really to be here. And I thank really Her Excellencies, all Excellencies, and the State of Qatar and the Gates Foundation for bringing us here together. Thank you.
Thank you, Dr. Rana. Dr. Joy, you're a former Minister of Health from Botswana. You're a leader of many global and African initiatives on public health. Staying maybe with primary healthcare, which is something that a lot of people in this room, certainly Her Excellency and others, have invested in and are familiar with. If one were to ask you about some of the successes that the global community has helped countries in the global south achieve when it comes to access to primary care, what comes to your mind in terms of successes and achievements?
Thank you so much. I would also like to start by thanking Her Excellency and the government of Qatar for hosting us, but also the Middle East Council on Global Affairs and the Bill and Melinda Gates Foundation. This is really a much needed initiative, and I'm privileged to be part of it, the beginning of it. I think what we need to focus on really is that when you talk about primary health care, what are the guiding principles? And I think Her Excellency talked about that. It's about the coverage, it's about the equity, it's also, I believe, about transparency and accountability so that you can take your people along, focusing on quality and safety. But the approach also has to be life cost. You can't address just one section of the population. There has to be integration and ease of access for everybody, even the hardest to reach. There has to be a referral chain that is clearly understood by everybody and available, community ownership, of the primary healthcare system, and a focus on prevention, early detection before treatment. So I'll just very quickly go through sort of the 8 essential components of primary healthcare and how countries have been able to partner with the global community successfully. If you talk about health education, there has been a huge advances in terms of training, particularly of nurses, doctors, medical specialists in developing countries. But we have also had a huge brain drain as well, which is sort of counterbalances that. But there's a huge difference really between the last century and this century in terms of, medical professionals and the training and the quality of the training. So, and this has been done in partnership with the development community. And there has been a improvement in recognition of the importance of nutrition. There was the Framework Convention on Tobacco Control. Though there is a nutrition component, there's the breastfeeding initiative. Currently, countries are taxing sugars, and all these initiatives are actually improving nutrition. But of course, we still have a long way to go in terms of, and there have been, processes that have increased agricultural production, focus on agricultural production, both by the big financial institutions like the World Bank and the regional institutions like the African Development Bank. But we still need to do a lot more on nutrition. There is malnutrition and stunting, some of it fueled by shortages of calcium for children. Some countries are coming up with innovative mechanisms, like in Rwanda, they have got milk bars. So when you go to a bar, not to drink alcohol, but to drink milk. And you see, this is very, very healthy for the community, and is also a good example of how to promote increase in milk production in the community. So nutrition, there's been progress, but there's a long way to go. There's also the supply of safe water and sanitation, which is essential for primary health care. There's been a huge investment globally in sanitation and access to water. But the mistake that we have made as a global community in doing this is that we have focused on the urban areas. So the rural areas are remaining behind, particularly in the area of access to sanitation. And it is having huge detrimental effects on their health and the health of the communities. So progress, but we still have challenges. Maternal and child care was a huge focus of the MDG era, and we still continue to focus on it now. But we now need to appreciate that primary health care is about the whole life cycle. We have huge challenges with youth, substance abuse right now. We have depression, mental health problems, and we have aging populations that our primary health care has not properly catered for. So we have successful programs on one hand, even though there's a lot of improvements still to be made, but we have population cohorts that we still need to address. Immunization, there have been huge advancements in immunization. EPIs in developing countries are supported by Gavi. Gavi has come up with the innovative financing mechanisms like IFIM, et cetera, which has really improved access to immunization. But we still need to work on how we introduce new vaccines more rapidly. We have this HPV vaccine, which still has limited access, even with the intervention of Gavi. So we need to find a way that when these new molecules come in, like the new malaria vaccine, how we can rapidly accelerate access in developing countries, whether it is by improving, having the manufacturing plants in developing countries, or whatever mechanism that we use. So appropriate treatment of common diseases, another pillar of primary health care. We have had the Global Fund, PMI, focusing on communicable diseases. But we know that there are other communicable diseases like NTDs, which have been seriously neglected, which also need catering. And we are very happy that at COP28, a new fund was developed for NTDs. Access to essential drugs, all of these funds like the Global Fund, Gavi, they actually make essential drugs available. But there is a challenge in terms of the supply chain. The supply chain is very, very expensive. It's unstructured, uncoordinated, and we can learn a lot from the private sector who are using blockchain to actually develop a supply chain platform which is easy to manage, but can actually take the molecule from the manufacturer right up to the mouth of the baby or to the arm of the baby much more rapidly than we are doing in the public sector. So we can learn from the private sector. So in conclusion, I think we've made a lot of progress, but there is a lot of challenge still remaining. And we have to appreciate that our population in developing countries is rising. So that means more challenges for us. Thank you.
Thank you, Dr. Joy. Dr. Chrysalis, the Gates Foundation is a very important player in the space of public health, globally, regionally. You've funded, you've designed initiatives, you've supported initiatives. The Global South Health Policy Initiative with us is one of many efforts you've spearheaded, both financially, conceptually, intellectually. I suppose one fair question to ask you, reflecting on the past decade or two, how much progress have we really made? And how much there is to go in terms of achieving basic objectives that we can all agree on? I say this also because you work with many countries in our region, including the State of Qatar, to support initiatives, to fund projects all around our region.
Thank you, Dark, for the question, and thank you, Your Excellency, for giving us the frame this morning to start an important discussion. As a representative of the Bill Melinda Gates Foundation, I'm very honored to be here today for what I think is really an important and very timely discussion. And as you said, Dark, hopefully will be the beginning of an ongoing dialogue that will help us further accelerate progress. In order to talk about the last decade of progress, I think we actually have to zoom out a little bit and talk about the last 2 decades of progress. You know, the Gates Foundation is almost 25 years old. And we really entered the global health world at an important time when there was the most rapid acceleration of progress that we've seen. If you think about where the world has come in the last 20 years, it's pretty remarkable. It's actually stunning. You know, the average person lives 6 years longer than they did 20 years ago. So whether 20 years have gone by or only 14, I'm not sure. You know, we've seen tremendous ability to invent and to deliver new vaccines, as Joy mentioned, but also a range of diagnostic, therapeutic, all kinds of innovations have not only been invented, often through public-private partnership, but have been delivered through another set of creative partnerships. So the progress is amazing. Since the early 2000s, you know, I think it was the year 2000 that we had over 10 million children under the age of 5 died. And today that's only 5 million. So we've cut global child mortality in half in the last 20 years. Back in 2000, you know, the world came together, set the Millennium Development Goals, that 3 of those 8 goals were about health. New institutions were formed, the Gavi Vaccine Alliance, the Global Fund for AIDS, TB, and Malaria, to take on very specific progress, and we saw incredible progress. Unfortunately, in the last decade, we've seen that progress slow. So we're still making forward progress, but we're not moving at nearly the speed that we would need to move in order to achieve the even more ambitious Sustainable Development Goals, which were set by the global health community back in 2015. And so I think we have to ask the question, why are we slowing? You know, we've seen maternal mortality really reduction kind of stagnate just in the last 8 years. We still have over 5 million children under the age of 5 who are dying, many often from preventable diseases. And so what is it that has slowed our progress? And one of the ways I think about it is, and this is why I think this conversation today is so important, and learning from the experience here in Qatar is so important, is that I think while we were in a haste to save lives, we often did it disease by disease, and we didn't pay enough attention to the underlying primary healthcare systems that are really, as Her Excellency said, the foundation of universal health coverage. So, you know, we saved a lot of lives, you know, in the 2000s, but we're slowing, and I think we have to pay attention to that, the message, which is that we need a more comprehensive approach. We need one that is a more sustainable look at the health systems, how they're financed, how they're staffed, and how we proceed so that we can get back on track in the Sustainable Development Goals. I think as Rana said, you know, COVID was a stress test. And if you look carefully at the differences between countries, there's a clear pattern that those countries that had strong primary healthcare systems did better in terms of having fewer excess mortality and morbidity, less disruption to their health systems than those countries, even of comparable income levels, that had weaker primary healthcare systems. So I think the message that we have coming out of the slowing of progress and the recent learnings from COVID are that we really do need to strengthen primary healthcare systems. And I think in that regard, we have some promising new things. We have new tools that are continued to be invented, often tools that will help to make the delivery of healthcare simpler, right? At the core of the primary healthcare system are those community health workers, again, as Her Excellency said. And so can we get tools that enable the community health workers to do things, to deliver care that once upon a time required very advanced degrees? So for instance, at the Gates Foundation, we're working on a whole set of new tools. One of my favorites is a handheld ultrasound device that you can plug into a cell phone that then feeds its data into an artificial intelligence system so that even a community health worker who may not be able to read an ultrasound but could do a set of simple, standardized ultrasound passes that then can help, the algorithm can say, you know, there's a problem here and this needs referral to the next level of care. There's all kinds of tools that are coming, some of which are already available, that we need to be able to deliver through stronger primary healthcare systems. At the same time, and I think this convening on the Global South Health Policy Initiative is a good example of this, is that we have a whole new set of partnerships emerging. I think that, you know, the work that the Gates Foundation has been honored to pursue with the government of Qatar is an example of that. You know, we've worked together, for instance, on the Lives and Livelihoods Fund with the Islamic Development Bank, which has provided support to a number of countries in Burkina Faso and Pakistan, many other countries, focused on how developing those key healthcare systems. And so I'm optimistic, even though we've seen progress slow, I'm optimistic that we can accelerate that progress through new partnerships, through new collaborations, and importantly, through a dialogue like the one we'll have for the rest of today and tomorrow, where we hear from leaders from the Global South. We have 9 countries represented at a very senior level to hear what the challenges are, because I think that's the other thing that perhaps in our haste to save lives over the last 2 decades we haven't done well enough, is to listen, to actually hear what are the obstacles that countries are facing as they see the progress slow, and what are the solutions, the innovative approaches that they want to propose for groups like the Gates Foundation, the Middle East Council, the government of Qatar, to engage in partnerships to help bring forward into new solutions that continue that progress of saving lives. Thank you.
Thank you, Dr. Chris. I want to give you a chance to put on the translation device to listen to our next panelist. He's the most popular person in the room, after Dr. Hanan, of course. Dr. Dio has spent the bulk of his life working at the Africa office of the WHO, working on some of the deadliest and debilitating diseases that affect the continent, like polio, measles, diarrhea, immunization coverage. With this perspective of decades and experience in mind, Dr. Dio, I'm going to pose a very specific question to you, which is, what are the setbacks that are driving the stagnation that Dr. Chris just talked about, that are causing the reversal that we're beginning to see in some countries when it comes to progress? Help us think through those setbacks?
Je vous remercie pour la question. Je ne prétends pas connaître toutes les raisons, mais je vais essayer de partager avec vous ce que je connais, parce qu'effectivement, depuis plus de 30 ans, je travaille avec la vaccination. Donc, je peux peut-être me permettre de donner quelques raisons. Mais avant tout, je voudrais remercier les organisateurs de m'avoir invité à ce panel, de participer à ce panel de très haut niveau. Voilà, je dirais que je voudrais un peu rappeler ce qui s'est passé, d'où on vient. Vous vous souviendrez que la plupart des programmes élargis de vaccination ont été créés dans les années 80. Et à cette période, il y a eu une injection massive de ressources. Et je pense que certains qui sont dans la salle, qui étaient vivants, se rappellent de James Grant, qui était le directeur exécutif de l'UNICEF, avec une décennie vraiment d'injection massive et avec l'OMS également pour l'appui technique. Et à la fin des années 80, on avait des couvertures vaccinales très élevées. Mais les années 90, la décennie des années 90, on a connu des crises économiques, une crise économique grave, des crises sociopolitiques, qui ont fait qu'à la fin de la décennie, la couverture vaccinale était descendue à 53%, surtout dans la région africaine. Ce n'était pas du tout beau à voir. Mais entre-temps, vous vous souviendrez que vers les années 95, le président Mandela avait lancé l'initiative mondiale d'éradication de la polio avec Kick Polio Out of Africa. Et ça, je pense que ça a commencé quand même à redonner de la vigueur au programme élargi de vaccination. Ce qui fait que, donc, comme je le disais, il y a eu les années 2000, des années où on a vu Gavi naître, Gavi est né, avec une accélération également, je dirais, de l'initiative d'éradication pour la polio, plusieurs stratégies, notamment les stratégies de porte-à-porte. Donc je parlais de Gavi qui a injecté beaucoup de ressources avec l'introduction des nouveaux vaccins, une fenêtre pour le renforcement des systèmes de santé, mais également l'initiative rougeole. Vous vous souviendrez que plusieurs campagnes ont été organisées qui touchaient des enfants de 9 mois à 14 ans, qui représentent dans la plupart des pays africains 50% de la population, mais également, vous vous souviendrez qu'il y a eu l'introduction du vaccin conjugué contre la méningite à méningocoque de type A, avec vraiment beaucoup de ressources. Et à la fin, on avait atteint 70%. Je pense que Dr Kamel Senoussi vous a montré la courbe. Et on avait atteint effectivement 70% à la fin des années 2000. On a commencé effectivement dans les années 2010 à avoir une certaine stagnation de la couverture et même une nette diminution. Certains, effectivement, quand ils parlent de la vaccination, ils disent que c'est dû au Covid, mais ce n'est pas vrai. La stagnation a commencé longtemps avant. Alors, quelles sont les raisons? Je commencerai par la première raison qui, effectivement, est la première, et vous allez comprendre pourquoi, c'est que les pays ne se sont pas du tout appropriés du programme. Ça, c'est très clair. Mais commençons quand même par une note positive. Il y a eu un engagement de très haut niveau. Dr Rana en parlait, de très haut niveau avec des résolutions au niveau de l'Assemblée mondiale, des résolutions au niveau du comité régional et même une déclaration des chefs d'État, qui est la déclaration d'Addis, avec 10 engagements. Les chefs d'État ont endossé justement cette déclaration, mais en 2017. Mais cet engagement ne s'est pas traduit par une dotation budgétaire pour faire face justement à ces problèmes. Donc, il n'y a pas eu de dotation budgétaire conséquente pour faire marcher les programmes. Les pays, effectivement, ont acheté des vaccins, ils ont participé même au cofinancement des nouveaux vaccins, mais ils ne contribuent pas suffisamment au fonctionnement du programme. Alors, les financements extérieurs sont bons quand vous les avez, mais également, il faut savoir que ces financements extérieurs sont imprévisibles et sont souvent même tributaires à des aléas comme, je dirais, qui ne sont pas du tout contrôlables. Je donnerai quand même des exemples comme le changement de leadership dans un pays, le changement de leadership politique. Il y a des partenaires qui se retirent carrément parce qu'ils n'aiment pas le nouveau leadership. On peut également avoir un changement de priorité des partenaires qui se retirent sans toutefois aviser. Donc, c'est bon d'avoir ces financements-là, mais il faut aussi que les pays contribuent. Il y a même des choses qu'on constate, que je dois dire malheureusement, c'est que ces partenaires qui voient effectivement que le pays n'a pas contribué commencent à dicter même les activités. Alors que le principe d'un seul plan, un seul budget, un seul monitorage est là, mais il n'est pas du tout respecté. Il n'est pas du tout respecté. Donc, je disais que c'est la première condition parce que le pays, pour que vraiment on puisse dépasser les 70% et continuer à arriver à plus de 80%, les pays doivent s'approprier du programme. La deuxième raison, je dois le dire, c'est la gestion non rationnelle des ressources. Gestion non rationnelle des ressources. Je vais utiliser certains termes qui sont durs. Malheureusement, on ne veut pas en parler, mais les activités génératrices de revenus personnels sont devenues des priorités, pour des raisons que je vais expliquer un peu plus tard, mais je pense qu'il faut le dire. Je vais donner des exemples. Il y a des sorties sur le terrain du personnel pour, soi-disant, aller superviser, mais du personnel du niveau central qui va superviser les centres de santé, en court-circuitant les provinces, en court-circuitant les districts. Ça, ce n'est pas normal. Deuxièmement, il y a des formations qui sont organisées, mais qui ne sont pas du tout justifiées. Mais tout cela, c'est la course au per diem. C'est la course au per diem, je dois le dire. Et je pense qu'on est là aujourd'hui pour le dire, parce que cela n'est pas dit. L'approche atteindre chaque district, qui a été une approche qui a fait ses preuves en Afrique, cette approche-là n'est pas du tout la priorité. N'est pas du tout la priorité, alors que normalement, c'est cette approche qui devrait nous faire arriver à des couvertures vaccinales très élevées. La dernière raison que je vais donner aujourd'hui, c'est les ressources humaines. Les ressources humaines sont au centre de tout développement, sont au centre de tout ce que nous voyons. Mais il n'y a pas de motivation de ce personnel. Pourquoi il n'y a pas de motivation du personnel ? Je pense que c'est clair. Ce personnel-là n'est pas motivé pour... Il y a plusieurs sources de motivation. Les sources de motivation ne sont pas seulement monétaires. Il y a plusieurs sortes de motivation, notamment lorsqu'il y a disponibilité des outils de travail, comme, je dirais, lorsque vous avez des vaccins, lorsqu'on a des équipements de chaîne de froid qui fonctionnent, on est motivé. La deuxième source, c'est la reconnaissance. hein, la reconnaissance du travail bien fait par son superviseur ou même par la population qui est bénéficiaire des services. Mais il ne faut pas oublier également qu'il y a une motivation qui est importante, hein, pour tout le monde, hein, pas seulement pour le personnel de santé. Il y a une motivation qui est un revenu acceptable, hein, pour mener une vie décente. Vous conviendrez avec moi que si on n'a pas du tout le minimum pour nourrir ses enfants, si on n'a pas le minimum pour payer les frais scolaires des enfants, si on n'a pas le minimum pour payer le loyer, hein, pour payer les médicaments lorsque votre enfant est malade, il est difficile, effectivement, de se concentrer sur le travail au niveau de la formation sanitaire qui est très exigeant. Vous pensez, vous rendez compte que cela, c'est pour tout humain. Donc, pour moi, il me semble vraiment important que pour exiger la performance, on essaie quand même de réfléchir sur les voies et moyens, hein, pour créer un environnement propice de travail, hein, pour que ce personnel-là puisse être performant. Je vous remercie.
Thank you, Dr. Dio. We're back to you, Dr. Joy, right now, as we make the reverse order in answering questions. Sticking with specific examples, Dr. Joy, malaria. Malaria has been cited as one of the leading causes of the stagnation and the reversal and improvements in child mortality. What specifically can be done by the international community and countries to help reverse what is taking place now?
Thank you so much. And I just think maybe I should start a little bit with explaining the severity of malaria. I mean, for colleagues who don't know. In our continent, that is in Africa, pregnant women, the bulk of whom are young women in their late teens and up to 30 years, are particularly during their first and second pregnancies, have reduced immunity to malaria and are therefore at increased risk of infection. Malaria in pregnancy has serious adverse effects on the mother, on the fetus, newborn, due to this low immunity. And parasite sequestration in the placenta, that means that infected red blood cells attach themselves to the placenta. So malaria in pregnancy increases the risk of anemia, mortality in the mother, the risk of stillbirths, intrauterine growth retardation of the baby, preterm delivery, low birth weight, anemia and mortality in newborn and in infants after they are born. And a 210 review reported that malaria in pregnancy is responsible for over 200,000 infant deaths in sub-Saharan Africa every year. It described other serious consequences on pregnancy outcomes, including increased risk of spontaneous abortion, early miscarriage, which means early miscarriage, stillbirths, preterm delivery, low birth weight, but there are long-term effects on these children. Even if the children don't die, there are long-term effects. 200,000 of them die, but the long-term effects is growth retardation and poor cognitive outcomes, which affect them for the rest of their lives. So the challenge that we have with malaria now is that at the end of the last century, we came up with very aggressive interventions for malaria, insecticide-treated nets. The Global Fund was created, PMI came into effect, heads of state got engaged somewhere, 2009 to 2010. So there were lots of activities, and there was a huge push in the fight against malaria. But what we did, but that huge push did not address the 100% of the interventions that were required. So the coverage with essential interventions only went up to 50, 60% in a lot of countries. But even that was enough to substantially reduce the incidence of malaria. Now, what we have done since the end of the MDGs is sustain that current level of engagement. So the coverage is still not enough. So because of that, progress has stagnated. But there are other factors which have come into play. One factor is climate change, particularly in East Africa, where there's a rise in temperature, there's flooding. So flooding increases breeding sites for malaria. Another important factor is resistance. There is now resistance to the old insecticides. So new nets with an innovative new insecticides have to be used, and these are much more expensive. And our resource availability is still the same as it was before the resistance developed. So the less countries are able to cover the same population, which is really 50 to 60% of what they should be covering now with the new nets. So there's a less coverage now with the new nets because they are expensive. But there's also resistance that is coming in now to the actual treatment, which has spread from the Mekong region in the Western Pacific. And there's a mosquito which is now biting in the urban areas, which used not to be there. So there are all these complicating factors that have come in. In the meantime, there's stagnation because of all these factors, and the incidence of malaria has gone up on the continent. So this is the challenge now, that we have to find new solutions, and when we find these new solutions, introduce them rapidly. These new nets need to be introduced rapidly. The vaccine, the new vaccine, vaccines which are being introduced need to be introduced, scaled up rapidly, but there is a huge shortage of resources. But there's also room for efficiency gains. I spoke earlier on about supply chain. We lose a lot of resources due to inefficient supply chains. There's a huge intersection between pandemic preparedness in terms of surveillance, enhancing our data surveillance, and also genomic surveillance at community level. So building that capacity. Currently, under half of the countries on the continent can do genomic surveillance. We need to move that up so that there can be early detection of outbreaks of malaria in order for us to intervene early enough and protect more children's lives. The other issue is that our community health workers, who are the ones who should be out in the villages, carrying out the health messages, prevention, are in short supply. There's a serious shortage of community health workers, primarily because it is not a formal cadre within our civil service. And a lot of the community health workers are not paid. So there is a huge challenge here about how do we get a cadre of community health workers that can do the integrated preventative services at community level that are required. So there are many challenges, and I think that we do have some tools that can help us, particularly efficiency gains and new innovations.
Thank you, Dr. Joy. Back to you, Dr. Chris. Thinking about the future, starting with this initiative, where we bring together representatives from countries in the global south, experts, technical experts, who understand the very problems we're talking about and are at the forefront of dealing with them. How do you see this initiative contributing to expanding access to primary health care as an example or a starting point?
Yeah. Thank you, Tarek. I think the key thing that we want out of today and tomorrow is dialogue. We have the right people in the room to have, I think, a robust dialogue about how we can get back on track for the SDGs by accelerating progress for primary health care, and to then follow that through with action. I know we're pressed for time, so I'll try and be quick. In terms of If I think about our slowing progress, use a metaphor. Imagine you're driving your car and it starts to slow. Well, why does that happen? Well, sometimes it slows because you're going up a big hill. And that's what we're doing. We've done, to some extent, the easy things. But delivering, you know, if you look at the burden of disease, we have a rising tide of non-communicable diseases that are going to require a continuity of care. It's not just, you know, a few interventions and protected for life like we see with many vaccines. So we're facing a change in the disease burden that is going to be like driving up a hill. It's more challenging as diabetes, as heart disease, hypertension continue to accelerate. Sometimes your car slows because it's running out of gas. And that's also happening, you know, as we face fiscal pressures in the overseas development aid budgets because of, you know, a remarkable increase in humanitarian crisis. I mean, look at the situation. I know many people here in Qatar are involved in trying to solve some of the crises in Gaza, in Afghanistan, the ongoing conflict in Sudan. I could go on. All of that's putting a burden on the international financing for health systems. And at the same time, countries are facing, in many countries, unsustainable levels of debt that are squeezing the domestic financing. So the resources available for the system are also under threat. Sometimes your car slows down because it has a technical problem, and I think that we also have some of that. You know, even in countries with resources, we see those resources inefficiently allocated. That, you know, more money is spent on tertiary care in urban areas than on the primary health care, and we know that 80% of the problems that that people face in health could be prevented or identified for early intervention within the primary healthcare system. And then sometimes it's a problem with the driver. And, you know, I think we need to bring those voices from the Global South more into the discussion about how do we take all of these challenges and find solutions. And so I think that the key thing is, and I hope what we do over the course of today and tomorrow is to look at the data, to understand the problems, to how much is it a disease burden, how much of it is a financing, how much of it is a effective allocation, spending better as well as spending more, and how much of it is who's deciding how to set those priorities. I think this is the right group to have that robust dialogue, and I look forward to hearing the outcomes over the course of the next 2 days. Thank you.
Thank you, Dr. Chris. Dr. Saleh, I come to you with the same question regarding Qatar's role. Qatar is an active player in international health. You recently have chaired the executive board of the WHO. How can Qatar, the state of Qatar with its institutions, help support Global South countries in improving primary care access?
First of all, thank you for saying Qatar, not the Ministry of Public Health, because we believe in one government and one health approach. Indeed, Qatar has been very active on the global health scene in the recent years, as everybody knows. As we mentioned, as Her Excellency mentioned in her opening remark, Her Excellency has played a very active role as the chair of the executive board of the WHO last month during the Geneva Executive Board. This was really an opportunity to ensure the voices of the Global South countries that are being heard in this international forum, and ensure that their concerns and requests were considered by international communities. But this is really an example, and it's really just one example among many other activities, as Qatar is actively engaged in many international organizations and extend support to a wide range of nations. We want to ensure that those different bodies address the needs of all countries, especially of those suffering from conflicts. the importance of allocating enough resources at country level and to important technical areas are among the aspects we always follow and ask about. And this is really coming up during the international meetings. So we welcome the Doha Global South Health Policy Initiative, where soft diplomacy and cooperation are the cornerstones that will allow us all together to strengthen resilient health systems as well as protect our populations, because we are really one population and we need actually to take care of each other's, because whatever is happening elsewhere is going to cross borders. So we believe that the COVID is becoming as an example of such event that really affects everybody. I should say reflect on the successes that has been highlighted, and we are always looking for the successes as examples. Sorry of really diverting from the question, but also we have challenges. And having Her Excellency Dr. Hassal Jabr with us, also we are really looking for innovations and also ways of communication. Again, we need actually our partners, whether really outside the public health, but they are really very strong players when it comes into semi-governments, private, but also the NGO are really essential. And we have Mr. Faisal Al-Imadi with us today, representing the Qatar Red Crescent. Also, we have shaking hands of the leaders, as being mentioned. That's really one of the challenges, as well as financing. Having all leaders within countries, and we have both the leads, Ministry of Foreign Affairs, as well as Ministry of Public Health, sitting side by side, looking for supporting their community, but also extending their support to other countries. I conclude my...
Thank you, Dr. Saleh. I think you spoke for all of us. Thank you. Last but not least, Dr. Rana. What would you like to hear from leaders in the Global South to help inform WHO policies, programming, and the direction of travel for all global health initiatives? How can the leaders gathered here today and the others who will be with us in the future play an active role in this?
That's great. Thank you, Tariq. I mean, this is really, it's been such a rich discussion. It's really difficult to sum it up, but maybe to add a few remarks based on all what I heard, and also, I mean, we have great, really cumulative brain power, in the room as well among all our partners and country participants. I really, maybe to kind of, I can see like a timeline almost in front of my eyes, from 2000 to 2020, which was, I think, 2 great decades where there were lots of global health initiatives, lots of innovation, lots of progress. I mean, I will be amiss if you allow me to mention, if I don't mention polio, which is very close to our hearts, but we are in really, really the last few, I wouldn't even say mile, even the last few steps, I hope, of polio, eradication in the region. Of course, the many diseases that were eliminated in our region, even despite emergencies and in the world, but also the many innovations. I mean, for what Joy mentioned, we have a vaccine to prevent cervical cancer. I never thought in my lifetime I will see a vaccine to prevent cancer in women. I mean, that's really a huge achievement. We have vaccines for malaria. I mean, I'm a bit biased for vaccines, but we have so many other innovations that we really need to take advantage of. But again, as Chris, I like really what the car example, Chris. I think it's something that everyone can understand. But at the end, I think we have to, moving on, we have to work for the next 10 years. I wouldn't say 20 years. The world doesn't have that patience anymore. We lost momentum during COVID. These kids who are waiting to receive these basic life-saving interventions cannot wait for us for 20 years. I would give us more, 10 years maybe, to catch up and accelerate. I think this is what we need to really focus on. Moving on, there are many new challenges, non-communicable diseases, climate change, a lot of challenges. But what we really need, I think, as a group to bring focus. I was looking at the title because the screen is in front of me for the last hour, and there are some very important terms in there, even if we reflect on, health is in the middle, of course, but global South, with the focusing on the problems in the South, with global partnerships, policy initiative. I like initiative because for me it introduces the idea of implementation. And of course it's in Doha. And that title by itself for me sums up a lot of issues because Doha has been a great place for facilitating, for moderating, not just for health, really for accelerating progress, negotiation. I mean, just these 2 weeks, so much is happening in health, in politics, in education. So I think I have a lot of high hopes, and I'm sure many of us have a lot of high hopes for this initiative. But I think as, also Deo mentioned, and Dr. Saleh, at the end, this is all about the people. It's all about the people. And we need to really keep this in mind. It's about ensuring people in the most remote place in the world, whether it's in a small village, as you mentioned, or whether it's on top of a hill. I've been, to places on the top of a hill in Yemen to give a vaccine to someone because they couldn't access it. This is what this is all about. It's about the people, but also it's about the people who are delivering, as Deo said. In Arabic, Lebanese, we say always, we shouldn't just build stone. We have to build people. لا نبني فقط الحجر نبني البشر. And I think part of a big thing we should do is to the drivers. Building the people, building capacity, the health workforce needs a lot of support. So I think last but not least, as we mentioned, we're all focused on these outcomes, but as Chris mentioned, the process itself is important. And I think this initiative is offering the dialogue to really identify what is it going to take to move from policies to implementation. And this is at the end, and to have even more success stories, as Dr. Saleh said, because I think the world is ready for us to have more and more success stories, and I really strongly believe, despite the complexity, with the focus, with the partnership, with coordination, because I think it's not just about money. I really believe, of course, we always need more resources. It's about coordination. It's about every single partner coming on board with clear roles and responsibilities and continuing to stay focused on the outcomes. So thank you again all for your attention. And
thank you, Dr. Rana. So just in the interest of telling our friends and the audience and colleagues what we're doing in the next 2 days, we will be conducting meetings over the next 2 days behind closed doors. These are meetings where representatives from the Global South, the 9 countries represented, will be doing the presentations. They will be identifying the problems. They will be proposing the solutions. Our role is really to facilitate these discussions and see how we can collectively help through this platform, which emphasizes knowledge sharing, cross-learning, to identify and establish an agenda for the Global South, by the Global South, in shaping future health outcomes. I'm especially delighted that many of the panelists have covered the issues we wanted to address in this public session. I need to also acknowledge the role of many of the participating organizations, not just the Bill and Melinda Gates Foundation, the Ministry of Public Health, Qatar, the Ministry of Foreign Affairs, whose support was critical to this initiative, but other participating organizations, Qatar Fund for Development, School of Public Health at Qatar University, and many others, individuals who've contributed to bringing us to this important milestone today. We will all be a part of this conversation, a part of this convening moving forward, a part of this annual initiative event. And as I said at the beginning, part of this movement we're starting that will hopefully, bi'idhnillahi ta'ala, get us to where we ultimately want to go. I want to thank the panelists. I want to thank the organizations. I want to thank all of you for being with us today. And I'd like to ask you to join me in expressing your appreciation for the kind words. Without further ado, I'd like to hand the mic back to Rawa, who will bring this public gathering to exactly the kind of conclusion we all would like to see and anticipate.
Thank you very much, Dr. Tariq, and all the panelists. You gave me a lot of responsibility. It's not actually my responsibility to bring the closing remarks. It's the responsibility of a lady that I personally admire a lot. You don't know, if you weren't in Qatar, that during the COVID crisis, we were led by these two women. We were led wisely, and we felt in real safety. And we are all very appreciative. Whenever I go out of Qatar and I exchange the experience of COVID, I know we were very lucky to be here and in both your hands. So the closing remarks are by a lady who's very passionate and very dedicated in her pursuit for a more just world. This is how I see you, Your Excellency. Ms. Lulwa Al-Khatir, the Minister of State for International Cooperation at the Ministry of Foreign Affairs of the State of Qatar. Please welcome for the closing remarks.
Bismillah ar-Rahman ar-Rahim. Good afternoon. Esteemed colleagues, honored guests, Your Excellencies, it is a pleasure to join you today for the launch of the Doha Global South Health Policy Initiative, an important and timely initiative organized jointly by the Middle East Council on Global Affairs and the Bill and Melinda Gates Foundation. It has been exciting watching the idea for this initiative grow and develop, from an initial conversation following the inspiring event on the power of innovation for a post-pandemic world held during the 2022 World Cup to this two-day convening. Today's opening session provided an encouraging start to the discussion, and I would like to begin by commending the panelists for their informative and insightful remarks on the critical issue of enhancing primary healthcare access in the Global South. Over the years, Qatar has played an increasingly visible role in convening discussions on development priorities in the Global South. For example, last year, Qatar hosted the 5th United Nations Conference on the Least Developed Countries, LDCs 5. The Doha Global South Initiative on Health Policy fits well within the development agenda and builds on a long-standing relationship between Qatar and the Bill and Melinda Gates Foundation to support development priorities in the Global South. Indeed, I would like to acknowledge the key role that my dear colleague, Chris Elias Gates Foundation President for Global Development, and his team have played in maintaining our special relationship, working to making this convening happen. I also want to acknowledge the wonderful work of my dear friend and colleague, Her Excellency Dr. Hanal Kuwari, and her amazing team at the Ministry of Public Health for their phenomenal efforts to develop world-class medical facilities and services in the state of Qatar. And in fact, I want to take this opportunity, Your Excellency, to congratulate you as well for the award for the best minister in the world you just received in Dubai. It is no coincidence that this initiative has found a warm reception and fertile ground to be established here in Doha, facilitated by Dr. Hanan's leadership on global health issues, including serving as the chair of the World Health Organization's Executive Board. The Global South Health Policy Initiative will also benefit from the expertise of leading global institutions in Qatar, such as the College of Health Sciences at Qatar University and the College of Public Policy at the Hamad Bin Khalifa University, among many others. From my own perspective, as Qatar's Minister of State for International Cooperation, focusing on public health issues in the Global South aligns very well with the development priorities of the country and the strategic vision of the Qatar Fund for Development. In 2021, Qatar provided over $70 million in development assistance to support healthcare in developing countries, with significant funding going to international institutions and initiatives combating infectious disease and delivering vaccines. Qatar will continue to support access to primary healthcare in the Global South. However, we are also interested in ensuring that this support is as effective as possible in improving healthcare and development outcomes for populations in need. In this regard, we note that progress on some key health indicators has stalled in recent years. Even prior to the pandemic, a better understanding of implementation barriers and bottlenecks limiting progress is needed to ensure that global efforts are successful, and I cannot find a better metaphor than the car example brought up by Chris. Such an understanding requires platforms to engage more openly and effectively with public health administrators and professionals from the Global South to better understand the bottlenecks that we face to develop strategies for overcoming them. We welcome our friends from the Global South to Doha to join in this convening. We wish you a fruitful and productive discussion, and I personally look forward to learning about the recommendations and insights that emerge from these discussions. Finally, I wish to acknowledge the efforts of the Middle East Council on Global Affairs, who led this development of this initiative from the inception to this initial convening, and who engaged with stakeholders in Qatar to ensure alignment with local capacities. While this convening represents an initial conversation with engaged counterparts from the Global South, we have high hopes that this will develop into an annual platform for discussing key development priorities in the areas of public health and beyond. Thank you very much.
Thank you very much, Your Excellency, and thank you, our dear audience, for attending this opening ceremony for the Doha Global South Health Policy Initiative. I should have known it by heart so far, but excuse me. So now I would like to invite the panelists, the ministers, and the workshop attendees to stage for a group picture. And for the rest of the audience, you can all be welcome at the reception. And we will also free the workshop attendees and the ministers just shortly after the picture. Please welcome on stage.